Valerie, I really want to just echo what you said at the very end, that you can have good science and good information essentially buried from action, from those who have to undertake action in public policy. And I think it's critically important, and the Academy, I think, does a great job at this, but it's really important to look at ways of sort of interpreting, translating the underlying science so that people can understand it in various ways. And I think that's critically important. Let me just ask at the beginning a question about stress. Adam, certainly, as you heard Adam speaking, you heard stress throughout. And you, Sarah, certainly emphasized that. But let's just drill down for a few seconds on this. Thinking about all these aspects of stress that children may or may not endure, which are the ones that are, in terms of what the science shows, are the ones we should really be thinking about focusing on, particularly, both because they may be damaging at that time, and also which are the ones which maybe over the long term we can correct in later life. It seems to me there's a debate about stress and about early childhood. One of the arguments is if you can't sort of fix everything by the time the child is 5 or 6, you've kind of lost them for life. Is that really true? And to what degree is that true? So what are the real stresses that we ought to be trying to focus on if we're going to enable us to move on a path towards equity? Sarah, what would be your reaction?
There were a lot of questions embedded in that statement. So, so as I tried,
one from five,
I tried to point out, I don't think that there's any point at which it does not make sense to provide support. So I think 99-year-olds should stop smoking and go out for a walk. But with regard to what does the science say about what kinds of stressors are most impactful for health? They are unpredictable, uncontrollable, instability, those kinds of features. And as has been highlighted in the toxic stress framework, they are also when those events occur without supportive factors. So in Adam's story, you probably noticed both a high degree of stress and some very important protective factors, right? So tight family relationship, helping each other, and that sort of undercurrent of we'll get through this, we always get through this. That latter thing I think is very hard to measure. However, I would love to see us do a better job at that.
Yeah, and I would say I'm very encouraged by some of the research that I see, where we're not only talking about just injecting, a booster shot in early childhood, but understanding that throughout life that there are critical. I'm using the term critical periods. I know that means something else, but I just use it in layman's terms. But there are critical periods where you need to revisit some of those challenges. One of our researchers funded a paper that talked about the burden of resilience. So we like to say that we have this program, these interventions, and we gave it, worked with these communities for a couple of years, and these kids developed resilience, and off they went, out of these high-stress neighborhoods, went off to college, and, we were successful. Fast forward 5 years, these kids are having problems and so forth because we take away the services, we take away those social supports, or I should say that maybe they don't have haven't developed the coping skills to help them function in that environment at that time, at that stage of development. And so what we find is that, or at least what this researcher found, again, that some of the burden of resilience is, what he calls, what he was studying in terms of allostatic load, and looking at all kinds of wearing away of system functioning and other kinds of challenges, cardiovascular disease, and all sorts of challenges. So I would say that we have to invest in children over the long course, over the long term, to make sure that whatever gains that we have, that they're sustained, and recognizing, just like if you're taking a long trip, you got to gas up, right, across the country. Right. One tank of gas is not going to get you from here to California.
Let me just, can I just ask one other quick question before we open up? And that is, are there some really, are there some steps we could take where you think the science shows we could get a really big payoff by the way that we actually do things? For example, I was talking to a family physician just last week who's actually based not in Appalachia, but but in Massachusetts, but in the town of Laurel, around Lawrence, Massachusetts, a very depressed neighborhood and so forth. And she said that the real impact that she gets is actually going to somebody's home, paying the visit, and not just talking medicine to that person, but looking around. What's going on in the home itself? What's in the fridge? She will often pick up prescriptions on the way to the patient because she knows that this patient is 2 bus rides away and is just not going to do it. Are there some really highly leveraged things that we could imagine doing based on the science that we understand where we could get some big payoff?
Cash transfers.
Cash transfers? Okay.
I mean, if you want to hit the core,
Well,
right? Cash transfers is a big part. And then I think if you want to get into psychosocial relationship building.
Okay.
And I would say help-seeking behaviors as well. We fund a number of studies that look at people's ability to just articulate what they need. Sometimes when you're so overwhelmed with the challenges of your day-to-day life, you don't even know how to ask the question, and you don't even know how to use the resources that are being brought to you. So some of the home visiting models, I think, are really important that help people to look at their homes, do environmental scans, and give them what we might take for granted, just some basic skills. One study looked at how they had to teach people how to pay their bills every month. One participant in the study thought that she paid her light bill this month, that it was done. She didn't have to pay anymore. So all of those things really matter.
Yes.
Ruth Lubick again.
Can you speak
Yes.
closer to the microphone, please?
I did push it. And I'm a nurse midwife. I have 2 questions to ask. When might we see a change in the definition of the perinatal period, which now is from the 28th week of pregnancy to the 4th week of the child's life, which is totally ineffective? And the other thing just wanted to ask, how many people have looked at Call the Midwife? Because what's going on in Call the Midwife is old-fashioned public health nursing with a midwifery component. And you talk about going into the homes and trying to help the people. It's there. It's all, I mean, it's a BBC thing,
Right.
but it's there for us to see. And we used to do that ourselves, but we lost it.
You have a quick answer to that?
I think your points are well taken. One of the, in this climate of requiring investigators, or I should say asking investigators to leverage existing resources to look at what works and to not to reinvent the wheel, but to build on that existing literature. I think those kinds of things we're seeing more and more. But, research takes a long time. There's a long window between when we actually get a study mounted and when we see results and when people have confidence that we can let these things be available publicly. So I think there are things in the works, and we need more time.
Back there.
Yes, I'm Gretchen Musicant from Minneapolis Health Department, and I was heartened to hear about our need to look at resilience factors more in depth. I have a pretty intuitive but somewhat science-based impression that positive relationships are certainly one of those assets. And I'm wondering if you could help us reach beyond this individualistic conversation we seem to be having to thinking about what do we do to build nurturing groups or communities, or how do we help create more of these positive relationships in a setting rather than just in an individual situation?
Valerie, is that something you want to take a crack at?
I would say that there are studies that we've funded where they looked at settings, and I think not only in our work, but I know that the W.T. Grant Foundation does a good deal of work in settings as well. But looking at what are those other ways that people have, families, their extended families, and even broader than that, what are those other ways that people have support systems? Because for some individuals, the family may not be the best support system. So looking at how we can identify what those best support systems are and what mentoring really looks like in different contexts and for different people.
Go ahead.
Just, I guess, a different sort of angle on the same issue. You know, we most of the protective factors we've identified by looking at resilient individuals and sort of looking back, what characteristics or they had this great relationship with a teacher or coach or that kind of thing. And I think that's really important and needs to be highlighted much more than it is. Another issue, though, is that we don't have really any understanding about how protective factors become biologically embedded. So if you have this nurturing, supportive, caregiving relationship early in life, what changes about your brain and body? Instead, we have a model that focuses on as if there were some sort of normal trajectory that's derailed by adversity, rather than that every single individual is the product of their experiences and other factors. And so I think if we push the science more to explain how experiences are biologically embedded, how protective factors are embedded, and how that carries forward, and then what derails that, we'd have a more direct answer to how to intervene than to look at the absence of a negative, as if flipping it was the same.
I think there's an online question that in some extent speaks to that too. Let me just read it. It says, it seems that the brain science for pre and early childhood is fairly mature. Is there a need to understand better adolescents' brain science, which I think partly speaks to what you just said? Do we not understand enough about this longer term impacts and also what interventions might work really effectively at the teenage level?
I mean, we need more, definitely have a better understanding, lots of progress in terms of brain science every day, more needed for adolescents and also the transition to parenting and also across the lifespan.
Victor wants to...
Adolescent brain development study. Several institutes at NIH are partnering on looking at adolescent brain development. So hopefully over time we'll be able to shed more light on that question. It's a great question.
On the issue of signs, I'm very encouraged by both your presentation and Sarah, particularly as you touched on epigenetics as a very important area of research. When you think about the now that we have the ability to collect so much data information, whether they are in fact behavioral information versus biomarkers, etc., genetic epigenetics, it seems to me that we need a cohort study, a large cohort study to be able to follow these individuals and look at predictors. I'm just curious in terms of your population when you study them, how big they are, and does it have the kind of bandwidth to be able to look at this long-term effect, which I believe with the big data will provide a huge amount of potential information for the future?
So I sort of bounce back and forth between using big national data sets where there is information like that. However, you can't dig deep into mechanisms and what's happening in families in those kinds of studies. And so I focus on recent immigrant families, Hispanic families, in particular, because the stress characteristics and the protective factors are co-occurring in such a high degree. And it's just a amazing population to work with in terms of understanding how both things move forward. But then I'll bump back to the national data sets to say, how does this map on to things that are happening in other kinds of contexts? So that's one way to do it. I think, big cohort studies are great, but they only have what we know at the time that they start is what gets measured, right? And things change so quickly that you end up feeling frustrated with that. And a lot of NICHD's budget is tied up in longitudinal studies, and so I think that's an important piece of the puzzle.
Yes.
Hi. Excuse me. I actually want to pick back up on Gretchen's question and to talk about the individual impacts, because I think
Just identify yourself.
Oh, sure. I'm Anna Ricklin from the American Planning Association. So planners are about building communities, and I think if we're talking about a culture of health and changing our culture to have different values, are huge at the core of our culture is individuals are survivors on their own. They have to figure it out. And If you don't know how to figure it out, then there's something failing about you. So if we're going to shift that culture, how do we, it's a big question, but in thinking about these things, what are some of the ways that we can support building community and starting with the family so that people are healthier, I guess, is the summary.
That I appreciated about the earlier presentation is that they were talking about meeting the needs of the community and having them indicate what they wanted, what their needs were. And I think starting with what's already in communities, what's already working, what do people already see as meeting their needs? Where are there clusters of people working together to solve their own problems and to identify and to solve and address their own problems, and what are the resources that they're drawing on, and to what extent can we invest in those to help further them, to strengthen them, to ensure that they're sustained over time. I think we don't do enough of looking at the assets and the resources that are already existing, and making sure that those are available for people.
Yes, a question over here.
Hi, my name is Callie Campos. I'm from Ready Nation, and we are a group that represents different unexpected messengers in communities. I'm going to talk about the importance of a culture of health and different educational aspects. So I'm really interested in how we can all become storytellers and different conveyors of this important information, both for people who really are doing the research, so really getting down to the lay people that information, and also how different leaders in the communities can play a role in that. Thank you.
Any thoughts on that?
I mean, I wholeheartedly agree. I think we have to be willing to take those risks and have those conversations. And I think we could do a lot to train our science base to talk, to listen and talk.
Well, and I also think we have to identify some of those in different types of research methodologies and more community-based participatory type research, more qualitative research, where we can identify who those unexpected messengers are and who might be key actors. In another session that I was in, I heard someone talk about how the mailman was an unexpected messenger because he comes to that house from day to day and sees either the mail taken in, and when that mail started to accumulate, recognized that there were some problems and that maybe an individual didn't have the wherewithal to come out and to retrieve that mail. So the kinds of studies that are that allow us to kind of look at the natural ways of being, the natural ways that people's lives unfold, and to tell those stories, to identify as many of those key players and actors in the lives of the families that we're trying to work with would be really important. You talked earlier about the challenges of measurement. So we have lots of challenges in terms of trying to, strengthen these methodologies and measure these kinds of outcomes, but they're really important for us to at least get started putting some science around.
It does strike me that there are a couple of barriers that you raise that we do have to think very hard about. I mean, one is that, as you said, there can be certain messengers. My mother used to run a sub-post office in Britain, and that was a place where everybody used to come and pick up their pensions and so forth. And she would notice if somebody did not show up, and so she would call up the district nurse, and then the district nurse would go and see what was going on. You know, that was going on. And we see this all over the country, but we don't study it in the same way that we study brain science. And it seems to me that one of the challenges in this area of research is to think, first of all, about crossing those boundaries more. It's been my observation, and you can correct me if I'm wrong, but it's been my observation is that in healthcare, you do tend to get a much more kind of vertical, specialized sort of approach to research and analysis than is often true in some other areas. Think about criminology. I've talked to a lot of researchers in criminology. They're very familiar with data sets and research in other fields and how to connect it. That's often less the case, I think, in healthcare. And then secondly, I think that these, how we think about what is a study of these kinds of examples, like messengers, because obviously the kind of data you can accumulate It's hard to do RCTs on mailman showing up, right? It's very hard to do that. And as one of the patterns that we are seeing in public policy, notwithstanding what we may be hearing the last few days, is that the idea of evidence-based policy making. If you can't show that something is the case over time, if you can't show that kind of data, then it's not worthy of being funded. It seems to me that there's a lot of things that have to be funded, both in terms of research and ideas, that don't meet that test, if we're going to discover the very things that we're talking about here. Anyway, well, thank you. We covered a lot of ground very quickly, and there's still a lot of unanswered questions, of course, but I appreciate your contributions and the conversation. And thank you. Let's pass back to Kimber.
Thank you. Thank you. You all did such a fabulous job, from the research, government funding, the basic science, to the applied science, to community, to policy. My mind is whirling, so thank you. That's fabulous. So we are going to take a break. What's great is that we have poll everywhere going, but I don't want to neglect Ivory Clark, who's actually in the back, who is running all of this. She's the mastermind behind the curtain, and she provides research support here on a range of projects at the academies on risk assessment, toxicology, education, and One Health initiatives. Prior to her work at the academy, she was a high school math and science teacher in Atlanta, Georgia, in the United States. So while teaching, yeah, that is in the United States. Sorry, reading a bio from our global work. I apologize for that. Woo. But while teaching, she was active in improving educational outcomes for her students and enhancing their potential as future innovators through hands-on learning and challenging curriculum development, doing God's work. Ivory's transition to the National Academies has allowed her to continue to combine her passion for youth development and improving the natural world through her work on consensus studies, workshops, and international fellowships. She got a BA in environmental studies with a focus on economics and policy from the University of Chicago, and her master's is in environmental planning and management from Johns Hopkins. So just wanted to make sure we introduced Ivory. Thank you. So let's all be back at about 11:15. So it's time for a stretch, quick bathroom break, grab a coffee. Our breaks are going to be very quick so we can keep learning. Thank you.